Mesenteric ischemia is a serious medical condition where there is a reduction in blood flow to the intestines, leading to tissue damage and potentially life-threatening complications. It can be classified into two main types: acute and chronic mesenteric ischemia. Acute mesenteric ischemia is a sudden reduction of blood flow, often due to a blockage in the arteries supplying the intestines, which can result from a blood clot or embolism. Chronic mesenteric ischemia, also known as intestinal angina, is caused by a gradual narrowing of these arteries due to atherosclerosis, leading to recurrent abdominal pain after eating. The causes of mesenteric ischemia vary depending on the type. Acute mesenteric ischemia can be caused by emboli, blood clots that travel to the mesenteric arteries, thrombosis, formation of a blood clot within the arteries, or non-occlusive processes like severe low blood pressure. Chronic mesenteric ischemia is primarily caused by atherosclerosis, where plaque builds up in the artery walls, reducing blood flow over time. Risk factors for mesenteric ischemia include advanced age, smoking, high cholesterol, high blood pressure, and other conditions that affect blood vessels, such as atrial fibrillation and heart disease. Symptoms of mesenteric ischemia differ between the acute and chronic forms. Acute mesenteric ischemia presents with sudden, severe abdominal pain, nausea, vomiting, and possibly bloody stools. This type of ischemia requires immediate medical attention as it can lead to tissue death and sepsis. Chronic mesenteric ischemia manifests as postprandial abdominal pain, unintentional weight loss, and fear of eating due to the pain. This pain typically starts about 15 to 30 minutes after eating and can last for hours. Treatment options for mesenteric ischemia depend on the severity and type of the condition. Acute mesenteric ischemia is a medical emergency requiring rapid intervention. Initial treatment may involve intravenous fluids, pain management, and anticoagulant therapy to prevent further clot formation. Surgical options include embolectomy or thrombectomy, removal of the blood clot, angioplasty with stenting to open up the blocked arteries, and, in severe cases, bowel resection to remove necrotic intestinal tissue. Chronic mesenteric ischemia is typically managed with lifestyle changes, medications to control risk factors, and surgical interventions such as angioplasty with stenting or bypass surgery to improve blood flow. Surgical management for mesenteric ischemia involves various techniques to restore adequate blood flow to the intestines. In acute cases, embolectomy or thrombectomy may be performed to remove the blockage, while angioplasty and stenting can help widen narrowed arteries. In cases where significant intestinal damage has occurred, a bowel resection may be necessary to remove dead tissue. For chronic mesenteric ischemia, angioplasty with stenting or bypass surgery can help restore blood flow and alleviate symptoms. Postoperative care focuses on monitoring for complications, ensuring adequate pain control, and gradually reintroducing normal eating patterns. A comprehensive nursing care plan is crucial for patients with mesenteric ischemia, both in acute and chronic cases. Preoperative care includes patient education about the condition, procedures, and postoperative expectations. Nurses play a key role in managing preoperative anxiety and preparing the patient for surgery. Postoperative care involves monitoring vital signs, pain management, assessing for signs of complications such as infection or bowel perforation, and ensuring adequate nutritional support. In chronic cases, nurses can assist with dietary planning and education to help patients manage their symptoms and prevent further episodes. Mesenteric ischemia is a complex and potentially life-threatening condition that requires prompt diagnosis and treatment. Understanding the types, causes, risk factors, and treatment options is essential for effective management and improving patient outcomes. Early intervention, appropriate surgical management, and diligent postoperative care are critical components in addressing this condition. Subscribe us for more videos like this and visit bizarrebiblio.com for notes and free PDF books. Thank you.